My name is Carissa Steeman, and I'm doing my presentation on gigantism, which is a rare condition that affects a hormone. And a hormone is a chemical substance that is produced in the body. And the condition affects a specific hormone called the growth hormone, or also abbreviated as GH. So there is a hypersecretion, or which this means like an excessive secretion of the growth hormone that causes this condition. And gigantism is a condition that causes abnormal growth that occurs during childhood. So the common causes of this condition, it affects the pituitary gland, so it's a pituitary gland disorder. And the pituitary gland is located in the brain, and it is responsible for regulating body function, such as hormone production. So hormone production also regulates homeostasis, which includes the growth hormone, which is affected in this condition. So the most common cause of gigantism is a tumor of the pituitary gland. When there's a tumor in the pituitary gland, it causes hypersecretion of the growth hormone. In simpler terms, this means that there's more growth hormone produced than usual that causes this disorder. And the main symptoms that are associated with this condition include very tall height, and this results from an increase in the length of the bones from the increased growth hormone production. Um, in this condition, the body proportions are normal, so there's not like increased certain areas of the body, it's just mainly increased height in these children. And children can also experience headaches, changes in their vision, and nausea. Some symptoms also are excessive diaphoresis, which is a lot of increased sweat, weakness, delayed puberty, and irregular menstrual periods in girls. So how they diagnose this is if doctors suspect that there is gigantism in a child, they will order a blood test that looks for growth hormones and also a factor called insulin-like growth factor 1. And if there's increase in these certain levels in the blood, then it's likely that the children might have gigantism. Another test is the oral glucose tolerance test, which children will drink a substance containing glucose, which is sugar, and then blood samples are drawn after the children drink these glucose samples. And in a normal child, GH levels will drop after drinking the glucose, but in a child with gigantism, the levels of GH will remain the same. So if these tests indicate that there might be gigantism in a child, then an MRI scan of the brain is usually ordered to visualize the pituitary gland so they can really see if there's a tumor on the pituitary gland causing this excessive growth and gigantism in children. This condition has also been studied in depth by many endocrinologists over the years, so they have methods that can treat this hormone imbalance. So treatment includes surgery or with medication. So surgery is just the excision of the tumor on the pituitary gland, and sometimes if these surgeries can't be performed because of certain risks, then medication will be prescribed, and this medication will either shrink or stop the growth or production of the growth hormone. So it can either shrink the tumor or stop the production of the growth hormone. Gamma knife radiosurgery is also another option if traditional surgery can't be performed, and this is a radiosurgery that delivers high focus radiation beams to a specific area on the tumor that destroys the tumor and doesn't affect like the surrounding areas. So there are treatments for this, and according to a statistic from St. Jude's Hospital, around 80% of children with gigantism are cured with surgery and medications and are able to live a long, healthy life.